Well, hello everyone, and thank you for tuning into another edition of Second Beauty You. I'm Deb, and I have a great dentist with me today. His name is Dr. D. That's what we call him for short. But Dr. D, tell us your full name.
My full name is Anthony DiGregorio.
Gregorio.
DiGregorio.
DiGregorio. Oh, see. I got it wrong. So that's why we say Dr. D. That's fine.
Yeah.
Thank you so much for being here with us today and talk to us Second Beauties, that is those of us who are 55 years old and over, about how to maintain and have a healthy and a youthful smile as we grow older, because as we grow older, our smiles can grow older as well.
Definitely.
So Dr. D is going to give us some great information today. So Dr. D, thank you again. So can you just tell us a little bit about yourself and how long you've been a dentist?
Okay. I've been a dentist for about 35 years.
Wow.
I've been practicing here in the Hyattsville, Riverdale, College Park area for most of that time.
Mm-hmm. This is my dentist's office. You see my smile? That's why I'm here. I love it here.
Thank you. Thank you. I appreciate that.
My husband started here first, and he's like, no, Deb, you have to come to my dentist's office. So I really like it. So 35 years.
Yeah, so we do, or I do all kinds of various aspects of dentistry, everything from smile makeovers to crowns to dentures.
Yeah.
I do extractions and root canals, and
Nice.
so I get to do a lot of varied things. But if it's something that's beyond my capability, we have specialists here in the office that we use.
Share with us, what are the dental issues that people who are 55 and older, what kind of dental issues do we have?
It is sort of twofold. Is as you get older, you can get more food caught between your teeth, because as your gums tighten up, there's a little more room between there. So people 55 and older start getting more cavities around the roots of their teeth.
Oh, wow.
Whereas young people get more cavities on the chewing surface.
Right.
The second issue is as we get older, our saliva starts to slow down, and we can get a drier mouth. And that can actually be kind of dangerous for the teeth, because the saliva helps wash away the sugar, but it also helps wash away the germs or the plaque that cause cavities. So I see a lot of my senior citizen patients who haven't had a cavity in 35 years. All of a sudden they start showing up with these cavities.
Right.
Because they still take care of their teeth and they still eat the same things or drink the same things.
Right.
But because the dry mouth makes them more susceptible, they're into this whole new phase of life.
Wow.
As you know, as you get older, different things start changing in your body. And so we look at treating senior citizens' mouths a lot differently than middle-aged or young people's mouths. And I have
Dr. D, when we were kids, we used to go to the dentist, regularly, like maybe every 6 months or so. So as aging adults, how often should we visit the dentist now?
I would say every 6 months is the most common thing, even aging. But there are two kinds of patients, whether you're aging or not. Some people are more susceptible to cavities, and other people are more susceptible to gum disease.
Ooh.
And so hopefully your dentist is telling you which one you are.
Yeah.
And most cavity people just need to come twice a year. Most gum disease susceptible people need to come twice a year, but some gum disease people need to come more often than that.
I know, I come every 4 months.
Me too.
Every 4 months, I'm in the chair getting something done to my gums.
It's about cleaning the tartar off.
Yeah.
Tartar holds on to gum disease germs.
Okay.
And if you form a lot of it, there's no way to slow it down, so you have to have your teeth clean. But as you get older, your body is not as resistant to those germs.
Right.
So you need to stay cleaner. So instead of getting your teeth cleaned twice a year, the gum disease people get their teeth cleaned 3 times a year, and some of us have to get our teeth cleaned 4 times a year.
Yeah.
But that's kind of rare. You have to be really super susceptible and
Yeah.
form a lot of tartar.
I'm one of these weird people. I love the dentist. I don't mind coming to the dentist. Some people are afraid of the dentist.
I'm hearing that more and more, that
Yeah,
people
I
don't
love-
mind coming.
Yeah, especially if you come, you have to have a great dental office because if the people here are just awesome. All the staff. Should I say where I am?
Yeah, sure.
I'm at the dental group, and this is in College Park or Riverdale, Maryland. Love this place. So if you're in the DMV area and you're looking for a great dental office, this is it. Do a lot of cosmetic type stuff, all the high tech stuff.
We do everything.
They do everything here, so definitely check out the dental group. So as we get older, some of us are taking medications and for various things. Does medicine have an effect on our overall teeth or gum health?
Absolutely. It doesn't affect the teeth directly, but the most common thing we see is medicines that the side effect is a drier mouth.
Okay.
And as we were said before, a dry mouth is more prone to getting cavities.
Right.
I mean, like 5 times more prone than a regular mouth with lots of saliva. The second thing we see is the bone density medications. They can affect the bone depending on the circumstances. Not all the time, but in some situations, if you need to have a tooth extracted, you have to be very careful about who does it and how it's done, because the medicine that affects the bone can affect the healing if you have a tooth extracted.
So some of us, as we start to get older, we lose teeth.
Yep.
And some of us are wearing dentures, and some of us are doing implants. So is there a cutoff age for when a person is no longer a good candidate for implants? Now, the reason why I ask that, my mother-in-law, she had implants for years, and they just started to fall out. So that made me think, okay, is there maybe it was just her overall gum health at that point, or is there a cutoff age that we should stop getting implants?
There is no cutoff age for implants. It is about the bacteria in your mouth, not the age of the bone or the gums.
Right.
And as we get older, if we don't have the dexterity to clean the germs out, sort of like flossing your teeth is hard to do.
Yeah.
It's the same thing with implants. If the tartar builds up enough, or no one's helping you get to the doctor to get your teeth cleaned. They clean implants the way they clean your teeth. You don't want the tartar building up on it, because it lets too many germs hang out. And so she basically got gum disease of the implants.
Okay.
The cool thing about implants is they don't get cavities. You can't get a cavity on it.
Now, I'm looking at this very handsome gentleman here, which you all may not be able to see, and this is one of my questions. My question is about braces.
Yeah.
So, my brother, who is, I think he's going to turn 60 soon, he has braces.
Yeah.
And Dr. D, he's not that age, but anyway, he's wearing braces on his bottom. So, is there a age where is there a cutoff age to stop wearing braces, or is that for all age groups?
It is for all age groups, and just like the implants, the age has nothing to do with whether we can move your teeth through healthy bone. Again, it's about bacteria. As long as the gums are healthy and you don't have a bunch of germs giving you gum disease, you can have braces. As a matter of fact, I see tons of patients who are 55 and older, and they finally get their last child through college, and they come in and they say, I got the last tuition bill paid, I've hated these crowded teeth, now I want braces, and yeah, you can do it. And just to add to it, with the advent of Invisalign,
so who's a good candidate for Invisalign, and who's a good candidate for braces?
It is, depending on the how complex it is to unravel the crowded teeth, that sort of can tell you whether you need the old style braces like I have or the Invisalign. Now, Invisalign has been around for 25 years now.
It's been that long?
Yeah,
Okay.
yeah. And so they have really advanced the technology quite well so that the more complicated cases can be done with Invisalign now. If for those people who don't know what Invisalign is, it's a method of moving the teeth, but instead of wires and rubber bands,
Right.
they computerize, create a clear tray, which is kind of like what a football player or boxer
Right.
wears, but it's clear so nobody knows you have it on. And every 2 weeks you get a new tray and it moves your teeth
Okay.
the way the wires do. But you can take it out to eat, you can
Nice.
take it out to clean your teeth, and nobody can see it when it's wet in your mouth. So lots of adults love this because they can live a normal life and not worry about
Right.
whether people are looking at
You
wires.
just wear it a certain amount of hours a day?
You wear it all the time,
All the time.
except for when you eat and clean your teeth.
Just, okay.
That's why it works, because you have to have constant pressure on your teeth.
Right.
Which is why they have wires and bands on the kids
Okay.
who won't wear it. You know,
Okay.
they'll lose it. It's amazing what we can do with people 55 and older, because what science has taught us is that our teeth will last. You know, we didn't, in the old days, we used to think it was inevitable we would have to lose teeth.
Right.
But if we control the bacteria in our mouths, then our teeth will last.
Awesome.
So it's just a matter of learning how to control the bacteria.
You hear that, folks? You can keep your teeth.
Yeah.
Be 90 years old and still have all your teeth.
I see it all the time now.
That's awesome.
You know, I'm not saying it's really easy to control the bacteria.
Right.
I mean, if you have arthritis, you have issues, but there are more and more products out that help make up for that, which is why I love talking to you,
Thank
because
you.
I can share all the new breakthroughs.
How about that?
I have sort of 3 things to talk about.
Okay.
One is how to make it easy to clean your teeth at home. As we get older, it can be a little more difficult. So we talk about that, then we talk about dry mouth issues.
Okay.
And then in the end, I have for people who clench their teeth.
I'm
grind
a
their teeth.
grinder.
Oh, well, then you'll love this.
Like my teeth in the back are flat. You can just, like, it's, you know, the grooves.
Yeah. We can start with that. Why don't we start with that?
Every time I come, it's like, okay, Deb, you need one of those trays to, you just stop grinding your teeth at night.
Yeah, there are lots of people who grind their teeth. And it's not a horrible thing, but some people get headaches from it.
Yeah.
Some people's teeth can hurt from it. And other people get muscle cramps.
Ooh.
It just depends on what your body doesn't like. So not everybody needs a full-time mouth guard, but mouth guards are can be very expensive.
Right.
But if you don't wear them all the time, then like the retainer,
Right.
if you don't wear it, then it doesn't fit, and
Right.
there's $800 down the drain.
$800.
Right. So if you do have grinding issues, they've invented a wonderful kind of mouth guard that is pretty much almost disposable.
Oh, really?
So you wear it when you want. If you feel like you've been clenching too much, or you're getting headaches that week, or your teeth are hurting from too much clenching, then you can wear it. And then after sort of you feel like you're not clenching as much, life is calming down a little for you, then you don't have to wear it.
Okay.
My wife and I both wear these when life gets intense. So what this is, I don't know if people have ever heard of night guards or know about night guards, but the things if you're grinding or clenching in your sleep, you put this on your teeth at night, and it keeps your teeth apart and your muscles stretched out, so there's not as much clenching, and even if you do keep clenching, you're not doing as much damage or wearing your teeth out. So this one, this is called Grind No More. It comes in a box like this.
Okay.
You buy it at any of the pharmacies in the toothbrush section.
I've never heard of this one.
Yep, and it'll be hanging on a hook.
Okay.
It's called Grind No More. It costs about $14, so it's about $1 a night guard.
Right.
And these night guards are soft and flexible. They'll last anywhere from a week to a month or two, depending on how much you grind on them. Then you throw them away, and you pick out another.
Nice.
So it comes in this little pack. In the morning you get up, you rinse it off, you put it back in the pack
Wow.
so you won't lose it.
I'm getting that today.
Yes, so let me show you how it works.
Oh.
So, as you can see, it looks like this.
Uh-huh.
So this is going to go in your mouth and your teeth are going to
How
clamp
about that?
around this. So
And you only need one,
you
right?
only need one. The lip holds it in place so it doesn't fall out because your lip is pressing against it.
Got it.
And right here, it's stuck between your teeth. So if you
That
clench,
keeps you from.
all right, you can wear it with this on your under your upper lip, or you can wear it with this on your lower lip.
Wow. Okay, grinders.
All
Let's
right.
get that. Grind no more.
The same company makes a more sturdy version,
Mm-hmm.
which is stuck in this little carrying case. This is called a Sleep Right. And it is basically a larger, tougher version of
Oh,
the
wow.
disposable one.
Uh-huh.
And again, you can see this part goes by your lip,
Right?
and this part goes
Between your teeth.
between your teeth.
Mhm.
And this is adjustable.
Oh, this is cool.
So if you have a smaller mouth, you bring the little bite piece more forward.
Right.
If you have a bigger mouth, it'll slide
That
back.
is so cool.
So you can sort of custom fit
Right.
it. And this will last you a good 6 months to a year.
And how much would this one?
This costs about $35.
Okay.
You can find these often in like CVS's or even Target sometimes
Right,
has these. Or you can order them online. And this is called Sleep Right.
Please be sure to tune in for part 2 of this exciting conversation with Dr. D. Until then, happy brushing!